Good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Harvey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions every Tuesday and Friday this week on the Harvey Institute for Global Health Facebook page. Today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest COVID headlines through today, the 24th of May. We invite you to submit your questions via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. Leading the discussion is myself, Sophie Bukowski, who's a student research assistant with the Institute. So Dr. Murphy, I'm going to start with some updated COVID statistics.
That's great.
So in the United States, yesterday we saw 133,000 new cases, with our 7-day average now peaking well over 100,000 cases, with a huge increase in the last 14 days. Hospitalizations are also increasing by 33%. Fortunately, we are seeing a decrease in cases by 15% in terms of deaths, but in Illinois, we are seeing an increase in deaths by 28%. And yesterday in Illinois, we saw 14,000 positive new cases, with hospitalization and, as I just mentioned, the death rate both increasing pretty high. What can you tell us was going on with 14,000 positive new cases in Illinois yesterday?
Yeah, it's just obviously it's everywhere. This is like another whole wave that's happening. We've been talking about the sixth wave for quite a while, and it's because of a couple things. One is that the current variant is highly contagious. And two is that our mitigations have basically been thrown out the window. And that's why it's spreading so much. We know how to slow this thing down. The good news is that the death rate has stayed pretty flat. It's up a little bit in Illinois, but it's coming from such a low level that, even a small increase will be a big percentage. So the vaccines are holding us down. And also the benefit of taking Paxlovid, the oral drug, also is keeping things kind of tampered down. But, what's happening is this wave is really growing. And they're talking about also, putting restrictions back on flying again, with more rigid testing before you get on a plane, maybe even domestically, because it's just really getting out of hand. In Europe here, I'm in South Africa right now, but I can tell you that here, you have to wear a mask when you're indoors anywhere here. When I'm in the hotel or the university here at the University of Cape Town, you have to wear a mask all the time. You can go into the restaurant while you're eating, you can take your mask off, obviously, but otherwise indoors, you have to wear a mask. You're in a taxi, bus, anything here, and you've got to mask up. Europe is kind of loosening up right now, but Africa is actually tightening up. So it's just a little bit crazy what's going on right now.
Yeah, absolutely. And, this goes right into our first COVID headline, which is the 3 doses of COVID vaccine are effective for kids under 5, Pfizer is now saying. So what can you tell us about this huge update that Pfizer has given us for young children?
Yeah, no, it's really great. I mean, the vaccines work. I mean, there's just no doubt about it. They work in adults, they work in kids, they work in everybody. And it's just yet another message that this thing is taking off again. And if you want to stay out of trouble, you may get infected, but if you want to stay out of trouble and stay out of the hospital, keep up with your vaccines. Take that 3rd dose, take that 4th dose if you're eligible for the 4th dose. And that's going to keep you out of the hospital.
Wonderful. And now for a second big headline, which is that Philadelphia is reinstating a mask mandate in all schools. What can you tell us about what this is going to do with this massive increase in cases in the United States?
This is what the cities and health departments have to do. They have to decide themselves now, because the national government has basically given up on this, trying to deal with it. And the reason why they've given up is that it's the public health measures are really left up to the states. So the states and the cities have to decide for themselves when they think it's right or wrong to enforce the mitigations. So Philadelphia has been kind of ahead of the curve here. They were one of the first places that reinstituted masks indoors. And now they're doing it in the schools. And, you're going to see this around the country. I mean, because these case numbers are just going out of this world.
Yeah, absolutely. And now our third and last COVID headline, North Korea claims, quote, positive trend in battling the virus. What can you tell us about what the government is saying versus what the numbers are saying? What can you share with us?
Well, this is the problem when you have a government that's very opaque and you really don't know what to believe. One thing for sure is that COVID has hit North Korea and they're very unprepared because they haven't vaccinated hardly anybody. So, North Korea is probably going through what New York went through in spring of 2020, and this is with a much more infectious variant than we had back then. So it's going to just rip through that country. No, they're very authoritarian. They can put lockdowns in, whatever, but they're going to be in a lot of trouble.
Yeah, absolutely. And now going into our first COVID question. This individual describes that her child cannot eat anything without tasting or smelling absolutely horrible. She can eat bread, cheese, and sweets only. And she's had COVID in December 2021, lost her taste and smell, then it came back, and it has since then been distorted. Is this possible? What can she do to help, make eating easier for her, etc.?
Yeah, no, the loss of taste and smell is can really be debilitating because all food tastes like cardboard. You basically don't want to eat anymore. And so first of all, the good news is that this does typically get better over a period of months. But in some cases, you basically have to learn how to eat and taste and smell again. So there's behavioral therapies you can go through to sort of learn that. It's a complicated process, but it is something that has shown to work. And you may have to seek the advice of a competent neurologist or somebody who knows how to treat this to actually learn how to smell and taste again.
Do you think it's possible?
I think it's possible. Yeah, I think it's possible. And I think also that the effects are not lifelong. Right. So those two things are going in your favor. There's people, I was just with a couple just a few days ago, and they both got COVID, young, otherwise healthy people. And the first thing that happened was the guy of the couple, the first thing that happened was he lost his taste and smell before anything else happened. It was very strange. And he's within weeks actually already has pretty much his taste and smell already back. So, it comes, goes, and it's probably not going to be lifelong. So, I think you just have to wait it out, or you have to learn how to train your brain how to taste and smell again.
Yeah, absolutely.
Yeah.
And now for our second question. This one's rather long, so bear with me. With the new increase in Illinois, where some communities are now at a high rate of transmission, this individual is thinking about getting their booster and they're eligible for it, but have been holding off. The reports have suggested a second booster does not increase immunity any greater than being fully vaccinated and having a booster. And they're also waiting to see if there should be a new vaccine that develops in the fall. With this increase in cases, Dr. Murphy, do you recommend a second booster for individuals that are eligible? Should they wait until the fall? What's your recommendation?
Yeah, don't wait. Don't wait. This is just so out of control right now. For instance, I had just gotten COVID, as I've mentioned before in the past, in March. I had a bad case in March. I was really sick for about 2 weeks. I got better. And then I knew I was coming to Europe and to South Africa here. And, I didn't want to get it again or whatever. So I took a boost, my second booster, so fourth shot, I took before I came down here. I had a big reaction. So this is what you call a hybrid reaction. You have COVID, then you have a booster on top of that. We call that hybrid, and it works pretty good. And, I knew it because I didn't want to get sick down here. But who wants to get sick anywhere? if you're eligible for that second booster or your fourth shot, go ahead and do it now, because who knows what's going to happen between now and when version 2.0 of the vaccines is going to be available. We don't know. We don't know if it's going to get approved, but keep up with your boosters. And then when the second version comes out, take that as well. It's likely to end up being, and some of the companies are actually making a booster combined with the next flu shot. So you would, and I think this is going to be the new normal, where at least once a year, you're going to get an updated version of the COVID vaccine along with your flu shot. So look at it that way. Don't wait. Take your other booster. It's not going to hurt you. What is the downside? Okay. I took that shot a couple weeks after I had COVID, which is kind of a time that you would expect to have a lot of side effects. Okay, I had a lot of side effects. I was kind of out of it for a day, but you know, it goes away, and then your immune system is really boosted, and you know that's what you want to do.
Getting hospitalized or dying.
That's so much better than being hospitalized, because it's just so contagious now.
Yeah, absolutely. Well, those were all of our COVID questions for today. Thank you, Dr. Murphy, and we'll see you on Friday.
We'll see you Friday, and stay safe, everyone.
Yeah.